Andrew, out of Melbourne, we know there was a big protest a couple of weeks ago, and you've got some information in relation to case numbers related to that protest.
Well, yes, Kieran, the number of COVID-19 cases linked to the Black Lives Matter protests in Melbourne 2 weeks ago have risen to 5. We already knew that 3 protesters have tested positive to the virus, but now we understand 2 cases identified today by Victorian authorities were linked to one of the protesters at the rally. There have been reports one protester at the rallies worked at an H&M store for 2 days after the rally, but it seems that some concerns at the federal level here around this protest are being borne out. We know they said that it would be 14 days after the rally before it was established whether or not there'd been a possible spread at the rally. And look, that's up to Victorian authorities eventually to explain, but the number of cases in Victoria kind of speak for themselves. So on that front, contact tracers have been sent from New South Wales and South Australia to assist in dealing with these Victorian outbreaks. The policy also seems to be to shut down certain suburbs and certain areas rather than the whole of Melbourne. This has been the policy that the Prime Minister, Scott Morrison, advocated from the start. He's always preferred this approach of suburb-by-suburb shutdown rather than statewide shutdowns. As one senior federal source said to me this morning, why should Bairnsdale be shut down because of these outbreaks? We know the big danger out of this is not just in Victoria, Kieran, and for the Victorian economy and livelihoods. It's for the whole nation if premiers now get squeamish about opening up borders. We were just about there in terms of that. Now, in New South Wales, the Deputy Premier, John Barilaro, suggested restrictions should be considered for Victorians coming over the border, particularly to the ski fields. He wants holiday travel from Victoria restricted. Let's have a listen to what he had to say this morning.
We've been strong about it in the past about keeping borders open in relation to protecting the community and the economy, but this is particularly worrying that we're trying to get out of the COVID crisis. We're lifting restrictions and now there's a real threat across from Victoria. So we'll have that conversation today along with the Premier and the rest of the Cabinet, and we'll make some announcements shortly.
Could that include closing the border?
Maybe some sort of limits around travel across the border, but maybe not closing the border as a whole. It's more about managing who's coming across the border and what we do on this side.
Well, this will be discussed at the New South Wales Cabinet this afternoon, as I understand it, but Gladys Berejiklian has made clear she doesn't want any border restrictions. It would be pretty hard for her to advocate for that after advocating so hard on Queensland, WA and South Australia and asking them to open their borders. But there are other ways to encourage people around a border closure. Let's hear from Gladys Berejiklian earlier this afternoon.
You should not be travelling to those hotspots at all, unless absolutely essential, but we would recommend nobody travelling to those hotspots. And certainly the Victorian government and the Victorian health experts have also suggested to people living in those hotspots not to travel around and not to move anywhere, and certainly not to go interstate. And that is their own advice in Victoria, and we obviously strongly endorse that. But we're also asking people to consider their trips to Melbourne. The advice is do not travel to those hotspots at all, so do not go to those hotspots. Reconsider your plans, reconsider what you're doing. But certainly Melbourne is a discretion. We would recommend people not at this stage travel to Melbourne unless they have to.
So Gladys Berejiklian effectively telling the people of New South Wales, the 8 million citizens, don't go to Melbourne at all unless you absolutely have to. Sounds a bit like a border closure, but not quite. Check this New South Wales health advice from today. It says, in line with the advice of the Australian Health Protection Principal Committee, that's the Chief Health Officers, New South Wales Health strongly discourages travel to and from areas of Victoria with COVID-19 outbreaks until control of community transmission has been confirmed. The Victorian Government has identified the local government areas of Hume, Casey and Brimbank, Moreland, Cardinia and Darebin as the focus of current outbreaks of concern. Sorry if I mispronounced any of them, not big on Melbourne geography. There are also locally acquired cases of COVID-19 reported from other areas of metropolitan Melbourne, so we urge anyone planning to visit Victoria to keep up to date with advisories. It's like a DFAT travel advisory in a war-torn country. This contrasts a little bit with the overall national statement from those health officers which noted yesterday that these outbreaks can happen anywhere. Let's have a look at that. It says, while these Victorian outbreaks are of immediate concern, it remains probable Australia will experience periodic outbreaks given the continued growth in confirmed cases in other countries and the number of Australians and Australian permanent residents still overseas who may return in sporadic community transmission. So what they're saying is keep up the physical distancing. Be aware in any part of the country that you are that you can still get this thing. A wake-up call, Scott Morrison and Gladys Berejiklian called it. Scott Morrison today pointed out that we just have to get used to this COVID environment and that he's offered Daniel Andrews support.
We said there would be bumps along the road. We said there would not be zero cases. We said there would be outbreaks. So the fact that there are outbreaks should not come as a surprise. This is a COVID-19 pandemic that is intensifying around the world, and Australia still remains, by a very long stretch, in a very, very, very good position. And localised containment, rings of containment, have always been part of the plan, together with, of course, the isolation, the borders work, the contact tracing, and all other states, including the Commonwealth, will lend support as is necessary to other states and territories. That's Victoria presently.
Just some more definitive advice now, Kieran. 4 now identified from the protests, not 3. 4 from the protests, 3 and a protester at the H&M store. So that's 7 potentially linked to the protests. And you'd have to wonder what other cases out there in the community are from those protests, Kieran.
Yep, indeed. It's the question that no doubt authorities federally will be monitoring very closely indeed as they try and shut down those suburban and local areas in Melbourne where there are hotspots.